Hi everyone. We're going to get started. So super excited about this particular one. As you know, part of the seminar series we bring in world-renowned academics in here to give talks, but we also are trying to help with community formation. So part of that is the industry coming together around different industry sectors and talking about what problems they are working on. And no industry, of course, is more dear to Canadians than medical medicine. And we have a great lineup of speakers who are here to talk about applications of machine learning in medicine. First speaker is Dr. Michael Schull, who's a doctor and CEO of ICES, Institute for Clinical Evaluative Sciences. So I've often heard it said that one of the unique advantages Ontario has is that it's the largest single-payer medical system in North America. So we have access to amazing data, and the government can be very helpful in directing medical research and doing and being able to use data better to affect people's lives.
Okay, can everyone hear me? Do I need to shout? Okay, great. So thanks very much, Tommy, for inviting me, and it's a pleasure to be here. I'll start off by saying I thought I was in the wrong room when I was told this was a machine learning seminar, because I know virtually nothing about machine learning, and I won't be talking about machine learning. Although we'll say we actually have been, some of our scientists have been doing some machine learning at the Institute with our data sets, so we can perhaps talk about that, and I'll probably be able to answer the first bit of your questions and not get very far. But it's a pleasure to be here and to talk to you. So some of you have probably never heard of the Institute, and maybe some of you have, but you've probably seen our work because it does tend to get a lot of attention in the press. A lot of our research tends to get spoken about in the press, in the media, and so you may know about us even if you don't necessarily know the name. So let me tell you a little bit about the organization, just so kind of we're all on the same page. We're a standalone research institute. We're publicly funded, not-for-profit, and we're physically located. Our main sort of headquarters, if you will, is physically located up on the Sunnybrook campus on Bayview Avenue. But we're not part of Sunnybrook Hospital per se. We just happen to be located there, and that's kind of a historical fact. We also have satellite sites on 5 other campuses across Ontario. So, campus downtown at the University of Toronto. We're at Queen's, at University of Ottawa, University of Western Ontario, and McMaster. And we will be opening a satellite in the north at Laurentian Health Sciences North and NOSM next year, most likely. We've been around since about 1992, so next year is actually our 25th anniversary, so we've been around for quite a while. And we've been funded continuously by the Ontario Ministry of Health since the very beginning. We get what we call a core grant or a small grant that pays for some of our infrastructure costs, and then we leverage that with research grants from federal agencies and other contracts from public organizations. We have what's called a prescribed entity status under Ontario's Protection of Personal Health Information legislation. And what that means is that as a prescribed entity, we can receive fully identified health information. So this is highly sensitive information. Most places aren't permitted to receive that unless they actually are custodians of that data. We are permitted to receive that data under legislation, which is how we do our work. And of course, when we're working with this data, we strip it of identifiers, so it is what we call coded or de-identified data. We're a pretty productive institution. We publish well over 300 peer-reviewed papers per year. Last year, I think it was around 417 or so. And in a variety of rankings that have been done, bibliometric exercises, third-party bibliometric exercises, we rank very highly compared to other health research institutes around the world. In addition to the research that we do, we also work closely with health system decision makers. So we will get questions asked of us from the Minister of Health, from bureaucrats within the ministry, from health regions or hospitals, so-called health stakeholders can ask us a question, and we interrogate our data and provide a report to them. So it might be a simple descriptive analysis on hospitalizations for, say, congestive heart failure in a particular part of Ontario, or readmission rates in one particular region compared to another, or it could be more complex analyses that take more time to do. We do about 40 to 50 of those reports every year, and this is a service that we provide to the health system free of charge. Essentially, we're funded to do it through our core grant, and we allocate a significant proportions of our resources to respond to these sorts of questions. So we see that as a kind of value proposition to the health system as to why they should care about the work that we do in addition to our research. So we're not just a data repository. We do hold and manage a large amount of health system data, but we're also a community of experts. So there is a range of individuals that are either employed by or affiliated with the institution. These include scientists, includes epidemiologists, analysts, privacy experts, and obviously the administrative staff and so on for the institution. But that community has really developed an expertise around how to use our data over the 25 years that we've been in existence, to understand the strengths of the data, the weaknesses of the data, the things you can do and the things you can't do with the data that we have. And then, of course, there's the data repository. So as a result of our prescribed entity status, we have negotiated data sharing agreements with a large number of data partners across Ontario. And so we receive on a routine basis virtually all of the what we call administrative data that's generated by all of our, any one of us that has an OHIP number. When we interact with the healthcare system, whether it's going to a hospital, being admitted, or going to the emergency room, or going to see your family doctor, or if you're over 65 or on disability benefits, you can get your prescriptions paid for by the government. Any of those interactions, we get individual level records or some kind of abstract of that encounter, which we receive routinely at our institute. There's a whole range of other registry type data we get. So cancer registry data we receive from Cancer Care Ontario, cardiac registry, cardiac care from the Cardiac Care Network, and then a variety of other data sets that are brought in, sometimes bespoke data sets that are brought in by our researchers to answer particular questions. These data, as I mentioned, are individual level, meaning we have data on individual patients as they move through the system. They're linkable across parts of the healthcare system, and they're linkable across geographies of Ontario and over time. So we can actually follow individuals virtually from birth till death as they transit through Ontario's healthcare system. We have about 187 scientists and around 200 staff across our network that creates the Institute and its community. So this is a schematic of our data repository, and you can see that there are a variety of different types of data sets. Some relate to care providers and facilities, so information on physicians and hospitals and long-term care facilities and so on. We have information on actual health services, so physician claims, meaning when you go and see a family doctor or a specialist, a claim is generated, and that data we have. Data about admissions to hospital, emergency visits, prescriptions, home care, rehabilitation services, long-term care, and so on. We also have demographic data, data on births and deaths, cause of death, and a variety of information from StatsCan that allows us to generate, for example, neighborhood level income information to control for sociodemographics. We also have a number of specialized data sets, things like the registries that I mentioned, but we also have negotiated agreements with a couple of federal ministries, so one being the Immigration, Refugee, and Citizenship Ministry. So we have a data set that identifies all immigrants and refugees in Ontario, so it allows us to identify who they are, when did they arrive in Ontario, where did they come from, and then again follow them through the system as they interact with the healthcare system. We have indigenous population information and a few other specialized data sets. All of these data sets, as I said, are linked at the individual level, generally using an individual's OHIP number, although on some data sets we don't have an OHIP number, and so we do what's called probabilistic linkage, where we link using names and birth dates and postal codes and so on to bring these data sets together. These data sets are brought together generally around a specific research question or study that's being carried out, and those analytic data sets are then made available to our research teams. Another thing that we established about 2 years ago, and I'll just mention that Charles Victor, who's our Senior Director for Research and Data, is here with me today if you have questions at the break or after the seminar. Just about 2 years ago now, we received funding from the CIHR and the Ministry of Health of Ontario to establish a platform called Data and Analytic Services. And this platform enables researchers from anywhere across Canada to have virtual access to our linked de-identified data set around a specific research question. So if you're a researcher, if you're a faculty or a student at a Canadian university, you can, through our website, contact our staff, who will walk you through the process of how you would access a linked, de-identified data set that you would then access through a secure VPN link for a study that you wanted to carry out. You would have to have REB approval for that study, and it's done on a cost recovery basis. So there are some costs associated with it because our funding, unfortunately, doesn't allow us to pay the full cost of this. But this is a service that's been very popular. Over the last 2 years, we've already had upwards of 300 requests for data sets. And about 90% of them are actually feasible. In other words, the researcher asking the question, we were able to determine that, in fact, yes, we do have data that could potentially answer that question, and those projects are proceeding. We've also begun the process of opening this up to international researchers, although there's still some work to do because of various things around data sharing agreements. And we have launched a pilot program of working with the private sector as well. So we've initiated a number of projects with the private sector providing access. Actually, in the case of the private sector, we're providing access to analytic services. In other words, they don't have direct access to the data. They would work with our analysts. It would be our analysts who would have direct access to the data, but it would be under the direction of a private sector researcher. Privacy and security. Now, this is personal health information, right? And this is probably the most sensitive kind of information or data that most researchers are likely to work with, in my opinion anyway. And there's specific legislation that oversees this that we have to comply with. So there are a variety of ways that we ensure the privacy and security of our data. The first is that we have that prescribed entity status that I mentioned. And as a result of that, we are audited every 3 years by the Information and Privacy Commissioner. We have to produce a report for that office indicating all of our policies and practices which are auditable by that office to ensure that we're complying with all of the bells and whistles that we need to from a privacy and security point of view. There are a variety of other measures that we employ, encryption of data, physical security measures, authentication, and so on, to ensure that only authorized users of data, whether it's within ICES or accessing it virtually, are accessing data and accessing only the data they need to carry out their particular project. So I'll just talk about a couple of new directions and initiatives that we've launched recently. The first is something we call the Ontario Data Safe Haven. This is a pilot project that we will be launching in 2017, and it's a joint project with the High Performance Computing for Health group at SickKids, led by Michael Brudno. This will be a platform that will be created to leverage the HPC capacity at SickKids, and which will allow for a variety of functions. For one thing, it will allow research data sets that are housed anywhere else in Ontario to be securely stored in an HPC environment. It will allow, if desired, that by the researcher whose data it is, it'll be allowed for that data to be linked to other ICES data. It will allow for those data sets to be made available to other researchers through virtual secure access. And we believe as well that it will allow for innovative analytics that couldn't be done on our current platform to be undertaken as a result of the HPC environment. So, for example, we've been having conversations with geneticists around linking genomic data or other omics data to the kind of data sets we typically work with for innovative studies. In all cases, researchers would need Research Ethics Board approval to access these studies or these data, and we expect that this pilot will be launched in 2017, as I mentioned. Secondly, we are launching data science as a research priority for ICES, and this is something where we see many opportunities to collaborate with folks that we haven't typically collaborated with in the past. Computer scientists, folks like yourself who have expertise in areas like machine learning, natural language processing, things that we haven't done a lot of in the past. So we've been engaged in all sorts of, in multiple forms of data science to support our research over the last 20 years or so. But we basically seen this as a research priority in its own right. How can we support the development of data science as it pertains to health sciences research using the kind of data that we use? And we undertook we created a small working group within the Institute over the last year, led by Dr. Therese Stuckel, who's a statistician, the faculty here at U of T and a scientist at ICES. And we essentially identified 6 priority areas for the Institute to pursue over the next few years under the banner of data science. One is around biomedical big data. Some of those are, as I mentioned, the omics data, but also data sets like the Ontario Lab Information System, which is a huge data set which we've received recently that includes every single lab result on lab tests that are carried out on about 95% of Ontarians over the course of their routine interactions with the healthcare system. We're working with this data set. It's a huge monster of a data set, and so there's a lot of opportunity for us to learn how to more efficiently manipulate that data set. We'll be also exploiting the high-performance computing environment that I mentioned a moment ago. Data integration and data quality. We see an opportunity to push our work and our research in that area. Data science methods. Data visualization is an area where we haven't, I think, invested as much as we would like to. And again, this is an opportunity for partnerships with folks who are more expert than we are. And finally, we're working to develop a distributed data analysis network across Canada with partners including the Canadian Institute for Health Information, StatsCan, and other data platforms from every province in the country. So we're pleased to be here, happy to have been invited. Didn't say anything about machine learning, so I apologize about that. But if you have questions now or perhaps for later, I'm not sure, tell me how you want to handle that.
Transition and people can ask questions while you're getting yourself set up.